Says it is. Hey, America, we're live. Welcome back to the Health Tech Talk Show. We have Lisa on a plane, or she was just on a plane because that's where she always is these days. Apparently, she can tell us about the new United Suites. She's very excited to tell you about. And we have Dr. Don Rucker, potentially my favorite national coordinator. It's unclear.
Some people are saying.
People say some of those things. But Don is here to tell us he has solved interoperability. He told me about it over drinks. Apparently it's real. There are several important officials engaged on this topic. So he's gonna like tell us about it, America. So Don, do you have anything you want to tease the audience before we go?
Yeah, they'll have to wait to hear how we solved interoperability.
Oh, yes.
Okay, great.
Great.
This is the tease.
Great.
Yeah, we'll give him
but
time
it is a real thing and quite interesting. So
okay, Don, tell us why it's Tefka.
Stop it.
To do
Stop it. Kat, you are such a troll.
I tried to straight face that too. Okay. All right, Don, we're sitting here in the back. Don't go anywhere. Don't get distracted. And we'll see you soon.
Yeah. This show is sponsored by Celsius. I don't know if you can see this because I have slept a whole grand total of 2 hours.
Yeah. So America, I'm not sure what the cow image has to do this week, but sometimes we don't know the graphic that we're getting, and this is where we are today.
I got like unsolicited messages about this. People loved it, just to be clear. So just so you know.
I feel like we're doing great here. So, but anyway, it seems to have no link to the show, but whatever. People can read into it. So
Lisa, I like those cows.
Lisa and I were both in DC this week, where we got some really cool CMS treasures. We were there primarily for the CMS Health Tech Ecosystem 1-year anniversary event, at which Lisa was actually a pledger and like got recognized. I just threw a party and so got a free coin out of it. But
hey, we all serve how we can. We all do what we can.
Listen,
some of us throw parties.
I have a few skills, that's how it is. But yeah, so I don't even know what things I've got here. Oh yeah, we also threw a party. This was my contribution, obviously. This was also my contribution, obviously. But anyway, Lisa, tell us what actually happened at this thing, because you were an actual real life participant, and I was trolling in the back, doing my thing.
Yeah. So this was the basically 1-year anniversary of the CMS Health Tech Ecosystem, where a little more than a year ago, I think about 60 companies pledged to join the ecosystem in a couple of different categories. One is CMS Aligned Networks, which Innovacer did, and a bunch of others. There was Kill the Clipboard and Conversational AI Assistant and all these different categories. And so roughly a year later, this was like, hey, a number of these companies have reached what they were calling general availability. And if you ask, like, what is this thing? How is it different than TEFCA? Yes. And really the difference is just like other things the administration has done. These are like voluntary, like bringing together potentially competitors to say like, hey, we're going to basically, I was going to say unfuck interoperability, but that is kind of rude for a family-friendly talk show. So here we are.
This is not a family-friendly talk show.
It was all I could think about because I literally have slept 2 hours. I'm sorry, everyone.
You're confusing this with your actual podcast that has approvals involved.
Correct. Exactly. And honestly, so what they did here is they recognize people getting to general availability. What you see on the screen, and they also announced a bunch of new categories and new pledgers and how much it's grown and all that kind of stuff. Cool.
And they had community theater.
And what you see on the screen here is a community theater project where they literally did a mock funeral for the clipboard. And it was hilarious. Some people got really into it. And then some people just spoke the way they normally speak, aka Dr. Tom Keene, who is obviously our other favorite national coordinator, who just did the full deadpan of reading his lines. I was in tears. He made me laugh the most, for sure.
Yeah, I can. So I was standing next to some officials in the back who were visibly cringing at the community theater skit. They were like, "Oh my God."
I thought it was hilarious. And
I think, like there are a lot of nerds in this audience. Clearly, I am
Listen,
not one of them.
listen.
But
We are
I will
nerds.
say the nerds were freaking into
Loved
this.
it.
But it sounded like Tom Keene, this was my interpretation. He didn't tell me this was how he was feeling, but it seemed like he was almost like just memorized and reading the lines to try to not embarrass himself
It
more.
was so funny. He was so funny. And this is a coffin, like it says RAP clipboard. And here and next to it we have our mourners with the roses. I believe that is Kristen Valdez, and I think Liz Lewis and
Morgan Taylor
oh,
was up
Morgan, that
there.
was Morgan. Sorry, no, it's not Liz. And then my whole thing was super bummed because I would have liked to have been in this community theater skit, and I would have liked to have been the person inside of the clipboard coffin, like breaking out, because
Because you're
unfortunately
still alive.
you're still alive. I would have done it. You know what? I could ham it up for sure.
Oh man,
Yeah,
that's the thing.
yeah.
Like, unfortunately, this
Listen.
it was too soon. It was born before its time because
Before
the
its time.
clipboard is not dead, sadly. But that's whatever. Like, I'm here for it. Anyway, this
Yeah.
was a fun. We had a fun time at this thing. It was super.
We
It
did.
was
We
great.
did.
Blah blah blah. There were parties and drinks had afterward. It was super fun.
Yes,
One funny
yes.
thing I will say about our party, which I'll go back to, Lisa, here,
It was good.
is that so I invited some friendly reporters to the after
Yeah.
right? Who I really like, and like people were avoiding them like the dead, right?
The
Like,
plague.
but I will say what was crazy. And so I had drinks with one of the reporters later in the week, and he's like, I don't fucking get it, Kat. Like, we're like reporters with editorial standards, like journalism, like ethics. We have to do like fact checking. Like, you can't tell us something and see it in print. Like, that isn't how it works. And he's like, and then they go talk to you and fucking Lisa and tell you all their secrets, and you guys have no standards.
We do have no standards. That's true.
And I was like, that is true. Like, we will give up our sources if someone sends us to, like, if they're like, you're going to prison or give us your sources, I'm giving up the ghost, y'all. Like, so yeah, I did think that was funny. It made me laugh.
Yeah. Likewise.
Yeah, right. Anyway,
It
this
was
is
fun.
great.
It was fun. And we had a
This
good
is great.
time. It was like, it ended
we're
up
having a
working
great
out
time
pretty
in
well.
this photo.
Yeah,
Don,
yeah.
Don is our party mascot. He was obviously at all of the parties of that evening.
Yep.
We did not secure a photo with him, but he'll come. You
He
can
was there.
just picture it. Just picture it. Okay. Anyway, all right. Moving on here. So at the Health Tech Ecosystem event, also 7 new pledges were announced. And Lisa, I'm going to make you tell us what those were too, because I don't remember.
I'll never get them all. I know one of them was for access participants. There was also there was like a prior auth one. There was like a price transparency one. There's a whole bunch of them, like 8 of them. Prescriptions. You can read about it on the CMS website for this, because I've had 2 hours of sleep. But generally they're like, hey, and I think here's what it actually means. You want something like halfway smart. What it means is that like Tefka and like other, methods of like exchange that are primarily business to business, which by the way is like always what we critique whenever we hear from like general consumers, patients, others. We're like, like I own my records. We're like, hey, most of the data exchange in America is like business to business exchange. Understand, I also like to have my data, but that's not the way we're structured. I like handing it to Amy and team, who are now in charge of the CMS Office of Technology and Products. I never get it right. And Amy is now the Chief Product Officer of CMS,
OHTP.
right?
OHTP.
Well, something like that. Sure, that's fine.
Whatever. People know what we're talking about.
The point is like handing it to them, like whether all this stuff like continues or not or whatever it does, like the thing that they are doing is like engaging a bunch of industry stakeholders, usually competitors, right, on like centering around real use cases that matter to real patients. And that is like it's just a different approach than literally all these interoperability efforts, which are very B2B intentionally and need to be, because there's a huge amount of business to business data exchange that has to happen in healthcare and a bunch of industries, right? So what they're doing is saying, hey, how can we accelerate like real use cases that matter to patients, whether it's like, don't make me fill out all my information 5 billion times with the clipboard thing, or whether it's like, it's like a price transparency thing to make it easier to shop, like whatever it is, like they're trying to center it around things that actually matter to like actual patients versus trying to boil the entire ocean. I think that's great.
Yeah. I think it's also a great place to start because it's like not controversial to say like, hey, do patient stuff, right? Like at least that's what I've heard from like any large vendor is like, okay, like that's like we're not going to argue
like
with
make any but they're saying like make any progress you can on things that matter to patients. Any progress. Do something.
This isn't even a criticism of the ecosystem. This is a criticism of the market. I think is that yes, the big vendors can like do stuff. Like the EHR vendors can like do patient access stuff, right? My issue is that a lot of these smaller patient access apps where this is their whole business have popped up waiting like baby birds waiting for their mommy to feed them for some sort of like government incentive to keep this alive, because it is actually really hard to sustain a patient facing app. Like if that is your entire business is patient subscriptions, it's real hard to find a bunch of patients to pay you $100 in ARR and not have them cancel, right? So that's my only like, okay, like what's really happening here to keep this going? Or are these a bunch of companies that are going to like just die out?
Yeah, I really don't know. There were some funny little digs because they had to read out. First of all, they did a great job on the timeline. Like they managed to get through the entire agenda like on time early. And they had to read out like all the names of the companies who were doing stuff. And at the very end, someone who will be unnamed said like, and Google, barely. I was like laughing so hard. There were so many funny things. But like it is interesting, right? When you look across what the administration is doing, like with access, for example, having some of the like industry stalwarts, like the bigger, more established companies not joining. And I think these are like lots of ambitious proposals coming through, which we talked about. We did talk about last week: Medicare physician fee schedule, RPM access, blah, blah, blah. Like, and maybe you have this later in your deck, so I won't try.
I do. I have the RPM one.
Yeah.
I have a very weak AI graphic for that. So just stay tuned.
Amazing. Yeah. Okay. We'll hold on that. Just, ambitious proposals, really trying to push the industry. Industry leaders will always stay on the sidelines if they have a working business model today, right? Money talks.
Yep. Money talks. God bless America. All right. There was another pledge thing later in the week. I was not invited, but Lisa, I heard you saw this when you were.
I was literally sitting outside in the lobby of HHS and heard it, and then saw people going in and out, and it was fun because this is one of the it's the same thing as being invited, totally, because I was there for other meetings, but there was like such a funny it's such a funny thing when you've like been in this world for a long time. And I'm hardly like the most Washington like swamp creature. I don't even live there anymore, guys. I fly in from San Francisco.
That's the way to do it.
But I can recognize so many people now at this point in my life, my aged brain. I'm just like, oh, so-and-so is here. Okay, they're doing that. Okay, it's so funny.
Yeah. But this is our girl Solomé, who is a behavioral health tech superstar. And the founder of the Behavioral Health Tech Conference. But she posted about, she was one of the actual real invitees for this event. And a lot of people were like, oh, was this SAMHSA? Was this part of Amy's thing? What is this? No, y'all, it was actually an HHS Secretary's Office initiative, much like I think they had another event a few months ago, I think led by the North Dakota governor's wife. I may have that totally wrong. Whatever. This is a talk show. You can't expect all your facts to be correct. But yes, this is yet another interesting pledge-like thing. A lot of payers were involved. So seems cool. Like not mad as far as I can tell. But like no one called me, so I don't actually know.
Yes.
Moving on. Lisa, this is my shitty graphic I made for you just now.
So exciting.
America, you may remember last week we had Mendel on our show and
rest and claims denied.
Whatever. This is what Claude made for you. It's supposed to be the Grim Reaper. I don't know. I don't know what happened, but you get the point. So Mendel Erlewine, and he was telling us, because we were like, oh, we heard that CMS cut the RPM reimbursements or no-go them because they're trying to push all those vendors into access. And he was like, no way, that's not true. But then he heard from a bunch of CMMI people, he was also at the event on Monday, and he was like, no, they told me that's totally true.
Yeah. It's
Yeah.
totally true. I mean, I can also not reveal my sources, but it is 100 million% true. And it's not even a surprise because when you read the physician fee schedule and you like look at what it's just like it's very clear. And the question that's been asked by multiple folks in government is show us the evidence and the outcomes and the value from RPM. They're like, show us. Like if you think this should be covered still, then you better prove it because we do not believe that the evidence is very strong. And Mendel actually on his LinkedIn and I think his podcast or whatever, he has put out a call for folks to say like, hey guys, you want like me to like keep RPM going with modifications, that make extra provisions for things like fraud, waste, and abuse. Like, let's join forces. So if you work in RPM and this is important to you and part of your business model, and you have evidence you want to share, like reach out to him because he is compiling that information and is going to be putting that in the response that he and others send to CMS to, help explain like what types of RPM should be maintained. So like, that's the point, right? This is what CMS is doing. They're very clear. I'm also very eager, as I have been from day one, to hear what other payers are doing. Those payers who pledged, the ones who pledged about doing something like an access model. Yes, their timeline is different. They pledged to do it by 1/1/2028. I would just encourage any of those payers, you could do it earlier also. You don't have to wait.
Yeah. Do cool stuff, prove some outcomes. I would be appreciative. Great. Okay, yeah. So speaking of outcomes and stuff, so this is the tempo. I think on our last show we said that Dexcom is actually the vendor that has been accepted into the tempo program. Is there one other, Lisa, or is it just Dexcom?
So far, they've only said one, as far as I know.
Yeah, so just like reposting something from Mario because I like him, and also I did this morning, and
he's a good actual reporter too.
He's like, if you want like real journalism, like I don't know, maybe go read his stuff. Also, their Stats Summit is October 14th and 15th. Lisa and I will be at the Adapt conference, riding a magic carpet in the desert, so we will miss it this year. However, it was really, really good last year, so everybody should go to that. Doctronic bought Summer Health because I guess now they're going to do AI prescriptions for babies.
That's like did you make sure to renew our media liability insurance?
Yeah,
just curious.
Listen, that's why we need more sponsors, you guys.
Okay, guys, we are fake media, not real. This is a fake news show.
Yeah.
Allegedly.
Yeah.
I don't know. I have to assume because these are, Doctronic is a new company. This has got to be an acqui-hire of some sort.
They basically said that. They're like, why should parents wait until their kids are not kids? Like, we're just going to start care at birth. Like, whatever.
Good times.
All I can say that if I was Summer Health, I would be delighted to be acquired. So congratulations, Summer Health people. Being acquired is always awesome. And I'm sure cool things will happen here soon. Although I will say, as a parent, I just know what my kids like, or at least I suspect what they need in terms of antibiotics, typically, pink eye drops. And if I could somehow game an AI to get that as opposed to going to the doctor, I am like down to clown, Lisa. Oh my God.
You already do that without going to the doctor.
Let's
just be real.
About? I think I previously disclosed my technique for acquiring medication for my children. But
it's not a surprise to any like pharmacist who is probably like, yeah, we know,
hey,
you clown. We know. Hey girl, we're aware. We know.
What are you doing?
I feel like they've seen this trick before.
Anyway, well, congratulations to the Summer Health people. I'm actually like pro Doctronic. Like I'm pro, like, especially like saying like, all the routine chronic care medications, like, yeah, like whatever. Sounds cool. HTI-5 is coming still closer.
So yeah, I having spoken to ONC this week, I am pleased to see that they have finally made it through the gauntlet. And I assume the gauntlet was some unnamed large EHRs who were unhappy with some of the things in HTI-5. TBD on that. I have high hopes here. High hopes in thinking that we are gonna
happen now. Like, do you want all the bots to scrape the screens?
I guess I've come around on this one. I don't want all the bots to scrape the screens, but I do want there to be a pathway. And I think one of the pathways that is interesting, we talked about last week about point click
Oh,
care's
what do
announcement,
they call it? The
authorized screen scraper program.
ASP. Love it.
um, I think I think that wherever we can, we should use like performant and available APIs for data exchange, but like some things don't cover everything and sometimes it's necessary. If there's any way that we can ensure that this doesn't affect performance or compromise security, then let's do that, because a screen scraper, a bot, is just what we now have rebranded as an agent. So it's an agentic pathway for doing this, and like sometimes that has to be the case. And
Yeah.
I'm okay with that as long as there is like some structure and some way to guarantee again that like patient data isn't being leaked and that there's no risk to performance of the platform. So I think that's what Point Click Care is trying to do. I'm not speaking for them. I don't know, but they've made a move that if I were predicting the future, I'd say anticipating regulation.
Yeah. Yeah. I don't like screen scrapers. I feel like I'd be so sad if I made a super cool product and then someone just like some bots came in and stole my shit, even though I made my customers sign contracts saying they would not allow those things to happen and they would not give out their credentials. I don't know. Just
Well,
saying.
PCC is doing the middle ground here. They're saying
Yeah. They're saying
don't give out your credentials willy nilly. Like
ASP.
do the thing. And I think that's a perfectly like, maybe that's not the best or the only middle ground option, but that seems on the surface without knowing anything else about it like a perfectly reasonable middle ground. Like fine, right?
Yeah.
I also don't want someone to like randomly give out their credentials to like random like
like
North
you like
Korean
vibe
bot
code
or whatever.
something in your mom's
Yeah.
garage. Like
Yeah.
what?
Yeah.
I don't know.
Yeah.
I think that's
By the way,
weird.
can I do a vibe coding rant, please? Please.
Yeah, I love rants.
Listen, I have been seeing, because LinkedIn is become, as we've discussed many times, a hellscape of AI generated content. Unfortunately, It was great for a while. There's a moment where it was great. And make LinkedIn great again.
Make LinkedIn great again.
and
Stop the bots.
There are some people out there who have really think that Claude is like the most amazing thing since sliced bread. I really like Claude. I think it's great. There's fantastic models there.
I like Claude too, but this is what Claude made for me. I don't know. It's not that good.
That's not that good. That's not that good. But some people are like vibe coding these like informational websites that are all full of garbage. And I just want to say once again, I can tell that you used Claude and used none of your brain and none of your time, none of your skill. And so please stop doing that. Please stop doing that. Like nobody needs that. Nobody needs that. Stop it. Stop it. And this goes for every single part of this. Like I can tell that you're using Claude because it is obvious. It is okay to use tools like that, but you also use your brain and your judgment and your skill. And stop it. Stop filling my feed with garbage. Stop it.
Just stop it.
We don't need any more trash.
And exciting news. I actually think this sounds really cool. Included Health is going to acquire Firefly Health, which I believe was like Jonathan Bush's first like great return from his yacht post Athena Health. Although I think he was just on the board, but this sounds cool. Like they've got, I mean, I don't really know, but like reading it sounds cool, right? It's like they're doing like kind of an alternative health plan situation, which is kind of rad. Allegedly they have outcomes. That's cool. I don't know. We'll see what happens here. Maybe they want to sponsor our show and like tell us about it. I don't know.
Great.
Oh yeah. So in privacy drama earlier this week, Lisa, did you read this?
This is a weird one.
This is also the same team that wrote the piece on HIEs sending autism and vaccine data to the CDC identified. So this was like a weird thing. Like this is actually not in HHS. It's this weird little agency, the Consumer Product Safety Commission.
A famous little agency, very controversial over many years. I'm not going to rehash the past here, but
I don't know.
The Consumer Product Safety Commission, very small, responsible for tracking and issuing recalls for dangerous products, like warning people that XYZ product is dangerous. Apparently, like gave a chunk of money to Kanza, which is a HIE in both in that runs the HIE in Kansas, also a few other like smaller HIEs that are,
Yeah.
I don't know all their
Like an
geos, but they've
MSO for HIEs? It's
something
confusing.
like
Yeah.
that, something like that. But it gave a good chunk of change to them to like gather a ton of medical records and share them basically to, I guess, identify products that were involved in like safety issues. Now, the problem with all of this is that they were asking for like identifiable data and
Yeah.
identifiable records. And I don't know everything, that's for sure, especially not today when my brain is run by Celsius. But like, I don't know why you necessarily need like everything to be super identifiable, especially for the
Yeah.
Consumer Product Safety Commission, like something outside of HHS. I don't, I don't think that it wasn't clear to me why this has to be identifiable data. I don't think it would have been controversial if it had been like we're doing like a registry of sorts or something that's like something that is involving like non-identifiable data for like a public safety or a public health purpose.
Yeah.
I'm a little confused about that one, but this did not
Yeah.
land well. Lots of controversy.
Yeah, lots of controversy per usual. But yeah, this is interesting too, because apparently this program has been going on and hospitals have never had to send identified information except in like
Yes.
rare circumstances when it's like, we
Yes.
need to call this person now.
Yes. They're gonna die.
And the other thing is that apparently, according to emails obtained by these reporters, Kanza has been saying that it's mandated and threatening information blocking if hospitals don't comply. And apparently a lot of hospitals are like, nope. So I don't know what's going on here, but that's shady. Not great. HIUs, please do cool things. Weird.
Yeah.
Okay. Well, this is another data breach situation. Maybe Don can tell us in a few minutes here if this like bodes well for his interoperability theory and how we're going to save America. But FTC has sued Hims and Hers because apparently they've been sending all their user data to social media for ads.
This just keeps happening. And all I can say is like, guys, you cannot use regular old consumer marketing cookies, tags, whatever, for anything that might get close to PII or PHI. You cannot. You can't do it. And it keeps happening and you're going to keep getting in trouble. You can't do it. If you are doing marketing or demand generation or anything like that for any kind of like medical or health or anything that includes PI or PHI, don't do it. The
Yeah, stop
FTC,
it.
stop it. And you know, I don't, not a sponsor, but they should be. But there's a company called Ours Privacy, OURS Privacy, who specifically helps like companies, and there probably are others now, but they were one of the earlier ones who specifically work with like companies who do like marketing and demand generation and engagement with patients or, you know, potential patient consumers to make sure that you don't freaking send user health information to Meta or Snap, who do not care and will absolutely sell your data on and exploit it and send you ads for, you know, your like whatever medical condition you have. And it's super messed up. And like, just don't do it, please.
Yeah, stop it. Also,
Embarrassing.
they are being also sued for making it impossible to cancel and to bill you before services are rendered. No big deal. Whatever. Cool.
This is the thing, you know. Anyway.
Yeah. Yeah, we got to cruise through because Don's got to explain interoperability to us. So like, whatever. Okay. All right. So yeah. By the way, America, if you are on Medicare, your Part D drug stuff is going to increase. Whoops. The Trump administration has been subsidizing Part D. They are reducing that spending by 40% this year. So so we have a quote here. Medicare officials said program costs are expected to go up, quote, a lot. So not great, but it looks like the Trump administration is trying to negotiate with drug manufacturers to reduce those prices. We shall see. New Mountain
Really
apparently
so.
is selling off Machinify. This was one of the companies that Matt Holt was supposed to buy with the new company Thoreau. And as we all saw, that ended in glorious press drama. So TBD here. Lisa, this was funny. AI government affairs firm. I think that
okay, I am very critical of Y Combinator because it is just encouraging like not great ideas. This one cracked me up. Shout out to the young people who have started this first AI native government affairs firm, allegedly. So pretty funny. It's also really funny because it's just funny. It's just funny. It's just funny. I'm just being snarky because I'm a jerk, and I think this is hilarious.
I think it's hilarious also. I feel like the secret sauce of the most successful government affairs firms are that they have personal human relationships. But
Literally, like
what the fuck do I know?
I have Claude. I have Claude also, y'all. And
like what are we gonna do? Like have Claude send us an email to send to the Senate? Like I don't know.
To put in the trash.
Dear
it's not that we need more email spam. We need more relationships to get
That's
stuff
what
done.
I think.
The end.
This I just thought was funny because apparently Clark Minor had left. It was confirmed by a random person at HHS, and now since this article came, HHS removed Minor's agents and CIO online before adding his name back following publication of this story. I don't know, whatever. It's like a drama.
Oh well.
Also, last story before we go to Dawn. Epic is building Wisconsin's statewide EHR system. So we're basically single platforming in Wisconsin.
I am
do you think it's
not
because
a
they're
fan.
so close to Canada that they're doing like socialist stuff?
I don't think
they got the infection.
Yeah. Also, probably that Epic Systems employs like half of the state or whatever, or at least half of Madison, and
so
also
like,
Verona.
Okay.
They're like, okay, well, we should just do this. Yeah. You know, this isn't what I would do if there were like questions about, you know, whether I was operating in an unfair way in the market personally. But that's just me. That's just me.
You know, capitalists have to make capital is all I got to say, Lisa. So if Becker's. I was gonna read the first paragraph of the article, but now it's saying Becker's is it's coming to get it's got a privacy issue, whatever. But anyway, yeah, it's basically like Wisconsin, the state of Wisconsin DHS is like, we are looking forward to all providers working together on one system, and I was like, that is like so not America. But Don, that's the solution: interoperability.
There is a meme that I will send you that is like basically making fun of people who are like allegedly capitalist, and then they cry when they get actual capitalism where you have like market competition.
Don, is what you're going to tell us that everybody should be on Epic?
Let me think about that for a second. Did you want innovation or not?
I mean,
no, we're good.
Did you want low prices or high prices?
High prices.
Did you want automation?
I love competition, and I love low prices, and I love options.
Well then maybe not. So sorry.
All right, well that's our show, everyone.
So sorry.
We're done.
Okay. Well, yeah. All right. Okay. Well, Don Rucker, welcome back to the show.
Thank you.
Our favorite national coordinator, depending on who you talk to. And so I heard a rumor that you had solved interoperability, and I was like, oh, really? And then this person told me that they heard you tell them this twice at one of my parties, obviously, and that they didn't believe you at first, and then they were like, oh shit, it actually might work. So I don't know, Don, you gotta tell us what's going on.
Yeah, well, all kinds of stuff at your parties. Who knew? Who knew? Yeah. So the thought here is, I mean, this is sort of one of these long running dramas. How do we try claims and clinical information together, right? If we're ever going to buy stuff and be intelligent about healthcare, somewhere we have to tie the payment and the performance, the product together. I mean, high tech had a big thing on it. Obviously, FHIR does that in a number of ways. But, thinking about this sort of noodling on this, it struck me that now that we have, arguably APIs enabled, and we can get into how much they're enabled, but now that we have APIs enabled, we could actually require something that is technically quite simple, which is requiring the URL for the clinical note to be placed in the X12 claim. So that sounds pretty nerdy.
Super
And
nerdy.
I know you guys claim not to be nerds, though I actually know that that's not true in any way, shape, manner, or form. But be that that claim different than this healthcare claim.
We don't have to be honest on this show, Don. That's the magic of the health. We don't have to be honest.
Oh, okay. Now you tell me.
Yeah.
Now you tell me. Okay.
Whatever.
So,
fake news show.
Yeah. Well, it's good. Jon Stewart revisited for healthcare. The interesting thing is what makes this doable, right? Whatever. X12, for anybody who's delved into it, is just a whole bunch of XML typically. And, what the claim is, what the CPT code is, what the ICD-10 code is, who the provider is, where you send the money, blah, blah, blah. And the claim originates, I'm simplifying, I'm leaving out eligibility checks, but it originates at the time that the note is coded. So what makes this sort of work is the people who are doing the coding, right? They're looking at an EHR, they're looking at what the, doctor, PA, whoever wrote. They're the ones who are doing the CPT code. They're the ones who are generating the claim, and they're the ones who know where the note is because they're looking at it. And so this is not one of these, like many, many things, workflow impossible type of suggestions. It's just the people who are generating the claim just put in the link to where the note is. Now, there are obviously some details about, how you do access afterwards, but the access fundamentally is no different than the claim itself, which tells you what the service was and who the patient was and who the provider was. So it doesn't really raise any net new issues. And the interesting thing from a procedural point of view, because I know you guys live for, government procedures.
That's mostly Lisa, but yeah.
And the unified agenda and, the fine point of the rules. So the interesting thing from the mechanics there is the CMS standards group controls X12. And, under HIPAA, right? These are the electronic data interchange standards that CMS has been regulating. They did some horse trading. It used to be Office of Civil Rights back in the day. Mm-hmm. Then they traded like 3 bodies and a mule, and then CMS got the standards group. I may be off on the trade. Oh, something like that. So the CMS standards group and CMS obviously has it within their power to do this, and it doesn't mess up the rest of X12 in the clearinghouse because all the fields are still there. So it is one of these things that is not a breaking update, which is a great thing in software. So that's the technical part of it. The interesting part of this is, well, there are a lot of interesting parts. So first one for CMS is, and they were sort of rife with fraud, as everybody knows, sadly. I've been victimized by Medicare fraud until I finally read my EOB and found out that Sunshine Solar Senior Services in Delray Beach, Florida, was billing Medicare $2,999 a month for urinary catheters, which, thank goodness, I don't need yet.
Holy shit. Seriously?
Seriously. Absolutely.
Wow.
Seriously.
And you just didn't, I don't open those things either. Holy shit.
I just happened to open it on the way to the garbage can, and I saw these charges were $2,999. And talking with the Medicare fraud line and doing my good duty as a citizen, they said, oh yeah, the fraudsters know that the audit increases at $3,000. So yeah, I'm amazing. And now I have a new Medicare number, but I'm not going to tell you what it is.
Yeah.
It's 1, 2, 3, 4, 5, 6, 7, 8, 9.
You want to share your social? And
yeah, it's probably shared somewhere.
Okay.
Yeah, right. But thanks for asking. Thanks for asking. So a lot easier to figure out fraud if you actually have the note, because then instead of just submitting a claim into the blue, you could put AI or whatever onto the note and say, hey, wait a minute, this person doesn't have any medical problems like this, has never seen a urologist, has never gotten medical care in Florida. You wouldn't need like the expensive version of Claude that Lisa buys. You could get like the budget Claude.
You can use mine.
Budget Claude.
Yeah, you know.
The budget Claude that made that illustration.
Yeah. Right. The one the cat uses.
Yeah. Call me.
Right. You wouldn't need to pay that much. And so that's one thing. The other subtle thing here is it probably helps solve, one of the claims and one of the challenges to a true digital economy, which is endpoint discovery, right? If we're going to, the modern internet works by domain name services. So you map, your talk show, StreamYard or whatever, and it goes to an IP address through a DNS server. That's what we need in healthcare. We don't need a bunch of brokers charging us a fortune and then charging whoever they sold the stolen data to another fortune, right? CMS in the National Provider Directory should do what is literally the next paragraph after TEFCA and the Cures Act, which is CMS should stand up a National Provider Directory. So those URLs, you can discover them better if you have the claim and the clinical together, and you can solve the attribution problems. One of the thorny problems with with attribution and provider directories is, let's just say docs, but obviously it's everybody who's billing in healthcare. What group are they in? What TIN are they in? What happens when they change jobs? What happens when they're itinerants like me, who used to do a lot of moonlighting in all kinds of places and TINs, right? In all kinds of parts of the country, doing telehealth, right? There's a lot of complexity. This actually allows the machine to essentially update the National Provider Directory automagically. So it's a pretty interesting way of using really simple endpoint discovery to increase interoperability and get it out of the hands of brokers. So
but they are doing provider directory.
Yep.
Sort of.
It's exciting. Amy and the team, Fred Trotter. Kudos to them for everything they're doing there for the CMS Tech Alliance. Finally, after years of it being blocked by a certain organization, I can't say which. Well, it's actually two organizations. I can't say. One's a consonant, one's a vowel. So I'll let for the first initial. So I can't say that. Lisa jumped out of the airplane.
Yeah.
She did what they tell you not to do, which is open the exit door and jump out. I thought about it.
It was a better death than revealing.
I had the whole.
I was like, never mind. I'm just gonna before they put out a hit, I'm gonna just exit myself.
Our media liability insurance does not cover people murdering us, as far as we know. I don't know.
Boy.
Well, that's extra. So anyway, that's
so we have a comment, some critique from friend of the show here, and this is an important one. Providers don't want to share clinical data with the insurance company; they don't have to. Well, here's my thing on that one. Too bad. Right? Like we're if everyone jumps at the same time, like it will be easier.
Well,
I think.
So I love Michael. He has all kinds of smarts, but you actually agree to do that when you submit the claim, right? And you've actually already agreed, in essence, when you submit the eligibility check. To do that, and it is absolutely allowed under HIPAA, right? I mean, these are all covered entities. These are not entities in space in TEFCA land that have maybe no clear legal right to the data. These are people who are designed under HIPAA, and where the patient has an expectation that the payer and the provider are going to be sharing information, which is really critical here. Now, I think obviously Michael's right in that this is, these APIs, payer provider APIs have been sticky. There's all kinds of rulemaking sort of, already written or in flight on that. And I think ultimately, if you're going to have win-win, payers have to create incentives for providers to do the performance, right? And this goes over all of care. It's quality care. I mean, it's the whole point of Medicare Advantage and managed Medicaid. But yeah, the legal stuff is there, and the payers absolutely have a right to get the note that generated the claim.
Yeah.
So I don't think there are any legal issues.
Yeah, I agree. I totally agree. And I think, having seen some other sides of this, right? Like, yeah, I think payers accepted, or like, I think a lot of people, a lot of players in the space accepted the status quo of not getting the full chart or the full record. And that has created a lot of problems, right? Like I do think it's going to be like everybody has to jump at once to like remove any, okay, well, I'm disadvantaged by sharing with you, or I'm advantaged by not sharing with you, whatever it is, right?
Yeah, I mean, the interesting thing about this, and so Michael, maybe we'll rail against QHINs later. I'm
always down.
Comments. I'm absolutely for getting patient consent on all of this stuff. I'm a huge fan of getting patient consent on these things. I don't think any data should go to a QHIN without digital patient consent.
Right. So, I mean, that's the thing. Like the alternative of what we have now, we have the national networks, we have TEFCA, we have the QHINs, and patients have no idea where the hell their shit's going, right? And you're just buying in mass. And a lot of the QHINs are doing secondary use sales on the market, right? Like that's how they make money. That sucks.
Not to say anything about cons in the Consumer Product Safety Commission, but last I checked, that's a QHIN.
Yes.
Did I click myself out?
No, we see. We're still here.
Okay. All right. Yeah. Clicking computers, it's hard.
Yeah, it is. You are the former national coordinator, so
and that's why I'm former. Probably didn't click correctly.
Yeah, StreamYard is like too new.
Yeah. So it's interesting there. I mean, it sort of brings. I mean, and you guys have been bringing up a lot of the security privacy issues.
Yeah,
and I think one of the challenges, and when you go to brokered networks, is it's effectively makes true security very difficult, right? Privacy and security, though they're totally separate things on some level, because if it is just covered entities, patients know who it is, they have definable responsibility, and each endpoint can do zero trust, right? They know who their certificates are. Invariably, the people who have the true right to the data, patients, payers, and providers, know exactly who the other parties are, right? I, as a provider, maybe not an ER, but in general, am not going to book an appointment till I've run an eligibility check, all right? No payer has randomly sent me a check for money. Maybe there was one lawsuit where it did, but then I realized it was the wrong address, so I had to give it back. And then, they've already identified the patient and, know the patient's phone number. So those folks can do zero trust. Obviously, if you have brokered networks who are selling the data, then sort of the concept of zero trust, which is how the entire modern internet works and is actually required by HIPAA's privacy and security rules, interestingly enough, when you read them, it sort of becomes effectively impossible, which is an interesting conundrum of all of this. And that's why you have, tens of thousands of records being exfiltrated under various, and I guess we'll learn more as if the lawsuits sort of keep happening.
There's a lot of lawsuits.
But I mean, the CPSC stuff is sort of in that general category of things. Um, that's sort of an edge case, obviously, but yeah, I think brokered networks are, inherently insecure and prevent modern privacy and security.
Yeah.
I do like the no middleman kind of thing. That's definitely something. I'm sure there are some, and certainly there can be like good value adds, but it also just introduces so much.
Well, but I think it's sort of the way the rest of stuff works now, right?
Yeah.
I mean, every app on your cell phone knows who you are, has gotten permissions, has a business model that they've gotten permissions. It's the way of the modern world. Um, Kudos to the CMS team for having digital identity, right? That was always sort of the rub. And, as these new technologies and National Provider Directory, every one of those visits automagically generates the record locator services, right? One of the sort of claims here is, well, patients don't know, who this saw and stuff. Well, if that can be tracked backwards, right, for anybody on the call who's, a computer science nerd, these are pointers, right? Anybody's ever programmed in C, doubly linked pointers. And you have all of this stuff that you can now link without commotion, without brokers, and you can layer with whatever the permissions are. It's a pretty exciting time when you think about it. We finally, even if the incumbents don't want it, the power of modern computing is so powerful, it just breaks through. Now, I'm, like you, am sort of very, very curious about what the apps are that, I agree, if you're just doing a patient EHR app, that's sort of a brutal road to hoe today. Though I do have a solution for that too.
Oh,
you want to hear it?
I would love to hear it. And then you're going to tell us how the X12 thing is going to happen.
Okay.
In less than 8 minutes.
All right. So, so the solution is the Cures Act, which I read, interestingly enough.
I didn't.
Because I had a job where they paid me to read it. Actually, I read it multiple times. At any rate, requires all information. Now, when, on a non-kidding note, when we did the original Cures Act rule, so, that was birthed around 2018, the NPRM was 2019, the final rule was 2020, there wasn't a plausible way of dealing with the all part, right? There were no data standards. And so all we did is, if you look at the rule, and this is still the reg, is put in a stub that you have to label the data with something of your choice. Now, with AI and agents, to your earlier conversation about screen scraping and all of those types of things, now with agents, the ability to get all data has materially changed. It doesn't have to be digested into USCDI. That's not the only way to get data out of EHRs these days. And with, and with model context protocol and all the type of AI access things, ONC could, for example, clarify the Cures Act and say EHR vendors have to expose the entire API they're using for captive apps so that patients aren't tied to the EHR vendor's captive app. So I think we'll call that app parity, so that consumers have a choice and the app doesn't of necessity bind you to get your data. You can use other people's apps, right? And again, the security and digital ID makes those things absolutely secure, right? We've sort of solved that as well. So AI, besides cute pictures, will actually allow us to implement the all part of the Cures Act, and app parity would go a long way. I mean, I've been trying to shop for changes in my care here locally. As a patient, it's a freaking nightmare. Just to switch. I mean, I had to go to an urgent care clinic to get a referral because this delivery system, which will go unnamed, wouldn't, even though I'm a licensed doc in the state that the delivery system is in, wouldn't take my self-referral. And, I won't bother people with all the goofiness of it. But it's just violently anti-consumer at many, 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 many levels.
Violently anti-consumer.
So app parity would be a great way of getting a consumer level of goodness into the healthcare system. So, we'll be pushing that. For the X12 stuff, it basically is the CMS standards group saying, this would, I think, require NPRM, just for clarity and comment and transparency and goodness, and see if there are things that need to be refined, around security or whatever. But it's well within the X12 purview of doing this. And the beauty of it, it's not a breaking change in the software. So that's what makes it good. And Michael, yeah, I don't know about Fortran. My dad told me never to learn Fortran programming.
Okay, so
Nice.
it would need to get groundswell within CMS, get it put into a proposed rule.
Well, I think a lot of it's going to be pushed, frankly, because of the fraud stuff. Right. CMS, I suspect, are desperate for computational tools to prevent fraud rather than the pay and chase or whatever that acronym that they use, pay and catch, or I don't know, pay and chase.
Pay and chase.
Rather than doing it that way, because this allows you to do the analysis to a very high degree of fidelity right at the time of the payment. Right.
Yeah, absolutely.
Right. Tying into the thing that moves stuff along. Like it's tangible. Yeah. It's real. It has to happen.
Yeah. So anyway, that'll move interoperability in all kinds of ways.
Okay.
That's
okay.
Awesome.
So CMS folks, people who care about interoperability, please consider.
People we know, please consider doing this. That would be super rad. So would that Don, what would that do to the market? Would that it wouldn't totally wipe out the need for national networks because there's other.
No, I think there are a bunch of roles for national networks. So, it's worth clarifying. So first of all, I think a lot of the public health stuff, the HIEs are perfect at, because they have governance, they have physical facilities. So it's not just, the Vladimir Putin healthcare clinic that somehow got eligibility to be in PICOS, right? I mean, when you look at Medicare fraud, all of those people at these autism clinics and, the hospices, they're all in Medicare, right? They've been approved as providers in Medicare, right? They're not, they're already in the castle, in the moat. This is not, the Iliad and the Odyssey where somebody has to sneak in, right? They're already in the castle. I mean, I think that's how it would work.
Got it.
If I catch your question.
Yeah. Okay. Cool. All right. Well, Don, as usual, we appreciate all your insights, and we're sure that now you have explained this on the talk show that it will become
reality
regulation in no time at all. I'm not even concerned. We'll text some people. Obviously,
it's gonna be great. It's gonna be great.
Yeah.
But
everything I've done has been implemented immediately because that's why I've been in healthcare IT for 40 years.
Oh,
never mind.
No big deal. Yeah. Well, anyway, we'll see. Maybe, we can help, whatever, make that true eventually. Anyway. Okay, Don, it's our show is over. We got to go to the weekend. What last thing would you like to tell our loyal fans? Do you want them to write letters to CMS? Love letters to you.
No,
I don't know.
Just be clever about digital. It's changing. Just be clever about digital. It's real simple.
Love it. Well,
Amazing.
thank you, Don. As always, look forward to having you back on the show when this has become regulation and doing virtual
Has
check-in with
transformed
you.
everything.
Yeah, it's no problem. Okay. All right, Don, we'll see you next time. Thank you so much. Thanks, America,
See
for
ya.
watching.
Thanks, everybody.